Good morning. I am Dr. Sandeep Batra. I am a medical oncologist. I am based at Max Hospital, Saket. I am Associate Director Medical Oncology and I take care of the gynecological cancers. No doubt the gynecological cancers are the main cancers in the females, and that's true for the India as well. The major cancers that we see in Indian women are the breast cancer, of course. Worldwide also is the breast cancer is the number one cancer that happens to the females. In India also, the breast cancer, which was at number 2 position, has come to number 1 position now. Cervical cancer, which was the problem of the developing countries typically and also the problem of India as well, has gone down to number 2 because of the better medical practices, better diagnostic practices and better treatment available. So as far as females are concerned, there are three important cancers which they suffer from. One is the breast cancer, which is not the part of gynecological cancer, but it is the number 1. Second is the cervical cancer, which is the cancer of the uterus. Third is the ovarian cancer, and last but not the least is the endometrial cancer. Any female on this earth is predisposed to all these cancers, so no one is an exception. Anyone including the sun, under the sun including the sun, is exposed to the same risk. So as far as females are concerned, females who are into the high sexual risk practices, female who are exposed to the hormone replacement therapies, females who are active smokers, females who are using alcohol, they are relatively at a higher risk as compared to the other females who are not involved in these practices. So main challenge worldwide and especially so in the Indian context is the early diagnosis. So ovarian cancer is one cancer we don't have any screening modality or diagnostic modality. So about 2/3 of the patient, they are diagnosed in the late stage. In contrast, the uterine cancer and the cervical cancer, they can be diagnosed with the symptoms itself at an early stage. So any female who has had stoppage of her menstruation presents with bleeding per vaginum history, the diagnosis is usually C endometrium, the endometrial cancer, unless proven otherwise, and that can be easily diagnosed on a clinical examination and in a simple ultrasound. Similarly, the cervical cancer, which is the cancer of the mouth of the uterus, can be simply diagnosed with a pap smear test, which is a test done on OPD basis and costs almost about 50 rupees a test, and you can diagnose the patient immediately on the table and subsequently confirm it on a microscopic examination. So the main challenge for the Indian patients is that they do not present to their physicians or they do not tell their family members or the caregivers about the early symptoms when the disease is usually in the early stage. Only once the disease has created symptoms like pain or heavy bleeding leading to the secondary complications, they report it to their family members or the caregivers, and by that time the disease is usually advanced in the late stages. So caregivers, they are an important pillar for the journey of the treatment of the gynecological cancer patients. So look, when we are treating these patients, whether it is an ovarian cancer or a uterine cancer and majority of the cervical cancers, the main part of the treatment is removal of the uterus as well as the ovaries. So uterus beyond the reproduction age may not carry a significant meaning for the female, but the ovaries, which are the hormone producing organs of the body, and you are removing those organs because they are diseased, that takes away the hormones from the body, and the female system, that like the male organs, they secrete testosterone and the body's muscle bulk etc., they are based on that hormone. Similarly in the females, if you remove the repertoire, the reservoir of the hormones, there is a sense of decreased confidence, there is a less sense of well-being, there is an increase in the blood cholesterol and other parameters, leading to a detrimental effect on the overall health of the patient. So caregiver has to give a mental support to such patient to get out of the side effects of the hormone removal that we are doing by surgery in these patients. So the first and foremost, both the patient as well as the family and the caregivers have to be educated about the early signs and symptoms of the disease, and for that matter we routinely go for the education seminar, public lectures on individual basis as well as the corporate health responsibility basis. Second thing, there is something like the sense of shame that is there in everyone's mind, if especially in the females, related to the genital organs, that any symptoms related to that, they take it as a not to report to anyone, just out of the element of shame. So that feeling has to be removed from everyone's mind, that it's my body, anything abnormal happening to it an indicator that some disease pathology is developing into me, and I have to report it to the early. So if we can make them educated about the early symptoms, so that the early diagnostic process can be taken, so this problem can be solved very well. So my message to fellow doctors will be: suspect early, diagnose early, treat early, and give the patient the required referral at the required time. So many a time it happens that what the eyes do not see, mind doesn't know. So it's not only the patient and the caregivers, the doctors also need to be educated, and they need to continuously update themselves to what's happening as far as the advancement in the diagnosis and treatment of these cancers, so as to have an early diagnosis at an early stage, to give an early treatment. Early treatment also helps because that decreases the cost of the treatment. Now cancer is one of the costliest diseases to be treated, that involves in the early stages maybe only surgery, but in later stages surgery as well as chemotherapy as well as radiation therapy, that increases the cost. So fellow doctors should also get themselves updated by attending the meetings, going through the net, imbibing the knowledge from the journals, so as to get an early this patient diagnosed in early stage and timely referred to the centers which are well equipped in treating such patients, whether it's a government setup or a private setup.